And come up stage, connected-health.eu from Hamburg, Germany, the city that will hopefully run, well, hopefully hosts the Olympic Games next year, right?
Hopefully.
Okay, what's your name?
Johannes.
Johannes, Jakobite. All right. Now you got 2 minutes to pitch your idea, your technology, and convince us all that if we were investors, we should throw you with money.
Okay.
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 2 minutes.
Thank you for the most valuable thing you have, your lifetime. Our product is called Lifetime, and with Lifetime, you locally exchange medical documents and your health data between your smartphone and your doctor. Internet is not required. So we have combined a smartphone app where all your wearable tech and your medical data is inside. For example, if you're pregnant, as I said, wearable tech data, so we integrate all the wearable tech data. We've combined it with a small hardware hub for the medical field. It's system independent and plug and play. It works out of the box everywhere. So as a patient, if you enter the practice, and that's just a dummy, if you want to watch it live, please visit us. If you enter the practice, you connect locally, you transmit your medical data and your wearable tech data. Your doctor has access to your data. And when he produces a new X-ray, he just transmitted this back to the Life Hub. It's called Life Hub. So you take your data with you. It's an encrypted container on your smartphone, so you have your health in your hand. We'll start to roll out in the university hospital, probably soon in Hamburg, as well as other doctors in Hamburg. And then from there, we'll scale internationally. That's our product Lifetime. It's a local and secure connection between your smartphone and your doctor.
Excellent. Thank you. Are you a physician?
I am, yes.
All right.
And a software developer. I connect two worlds.
That's excellent. Who came up with the idea? In what context?
That was me. I programmed a small prototype, iOS to iOS.
Okay.
I handed it over to my colleagues and said, now I'm a patient, I visit you, take a look at my data. And they said, whoop, why do I have the data? How do I do it? And from there, because iOS to iOS is not possible in the hospital environment, of course, we need the hardware to enable every legacy system that is out there. Huge old systems, old interfaces. With this hardware, it's plug and play, and you just transmit and receive data.
Why do we need hardware at all?
Yes.
Because obviously you're shifting information and shifting
exactly.
information. Generally, don't need hardware. You have the internet.
Yes. We don't use the internet because doctor-patient relationship is so unique. You tell your doctor things you will never tell your wife or your husband. So the digital version of your doctor-patient relationship needs to take this into account. So how to enable an old system, like an old clinical IT system, to connect with all the new world? This is the only solution right now. Of course, in the next years, we can get rid of the hardware if we need to.
Okay.
Yeah, and we don't use the internet right now because I, as a patient, I don't want to have my data all over the world. I want to have it secure with me.
Mm-hmm. So what stage is your company in? You're looking for money?
Of course.
Of course?
Yes.
Have you just seed funding?
Well, we've just secured 135,000 euro as a grant from the city of Hamburg. Thank you very much.
Okay.
We are looking for 1.1 million, and we are in kind of progress talks with well-known venture capitalists. But of course, more talks wouldn't be bad.
Yeah, well, competition is always good for business, isn't it? In a lot of senses.
Yeah, so we are in alpha right now.
Okay.
And soon we are in beta.
Excellent. Thank you, Christian. And please have a seat.
Yes,
and we're going to have the elevator pitch of the second startup, which is Insulin Angel from Oxfordshire, UK. Who's that? It's you. Coming off stage. What's your name?
Amin.
Amin. Hello, Amin. Go ahead.
Yeah.
2 minutes if you
Right.
step there, and
Okay.
then you convince us that it'll be the smartest decision of our life to invest in you.
Okay, so hello and welcome everyone. Thanks a lot for being here. This is a device and an app we developed to solve two problems we have, and by we I mean diabetics. I myself am type 1 diabetic, and my little brother too, and the sons of my partners, they're also type 1 diabetics. We depend on insulin to survive every day. If we don't take our shots, that's on the short run very annoying, and on the long run very serious to our health. And living with diabetes today is not as hard as 100 years ago. We don't die from it anymore. But it comes with many challenges, and two of them are to keep the insulin in the right temperature range, so not too hot, not too cold, shouldn't forget in the sun or let it freeze or something. And we cannot forget it or lose it at home, because that would ruin our day and have health implications. So we decided to make this. We call it Insulin Angel. It's a Bluetooth-enabled Internet of Things sensor. It measures 24/7 the temperature of my insulin here and in the fridge. And every time it starts to get dangerous, I get an alert on my phone. It works for Android and iOS, and it also, very, very important, tells me when I forget it or lose it, so I don't realize after a couple of hours and it ruins my day. Also very important is a remote notification function for children or old people who don't necessarily react to that, so the notification is delivered to the carer's phone. We think this is a very important project for us. We put our own money in this, and all of our time, and we go into Indiegogo with a crowdfunding campaign, hoping to raise enough funds to go into production. And we'll be very, very grateful for your feedback, your support, and of course, spread the word and back us on Indiegogo in a couple of weeks. Thank you very much.
Bravo, Amin. And 1 minute 58 seconds, so that's what you call perfect timing. Well, I won't ask you why you came up with the idea. I think that's a bit self-evident. You said you're going for an Indiegogo campaign.
Yeah.
How far are the preparations? Do you have already a little bit of market feedback, how that might go?
Absolutely. So the idea is 2 years old. I started prototyping this 2 years ago, and then 6 months ago it started to go full-time. We use a product from another startup, relayr, Berlin-based, that makes it much, much easier to develop Internet of Things products, and it made a big difference for us. So we went through 4 iterations. We have an app that works now, and we've been talking with patients and doctors and pharma companies, and all this has been so valuable. We did a couple of pivots. One of them is, for example, it's valid for any kind of medication that's temperature sensitive and that's critical. It's not just insulin. Rheumatism, asthma, other hormonal disorders. And we are now ready with the campaign. We're doing the press outreach, and it will be live in a couple of weeks. And we'll go in production in June, hopefully.
There must be competition, or isn't there? Is that the only device that can do that?
Let me put it this way. There are many of these general object trackers, but none of them is good enough to trust with your insulin. None of them has a temperature sensor that's accurate enough, and they all compete on the cost. So they are very cheap, they're rubbish, they don't work. We bought all of them. There's nothing that does exactly this, and this is why we're doing it. If tomorrow someone comes and does this better than us, we'll be super happy. We'll go to the next thing.
Excellent. Thank you. And we also go to the next thing.
Sorry?
Have a seat, Armin.
Just
close up to us. And yeah, we have another startup from Hamburg. Kumi for Health. Whatever that is, we'll know in 2 minutes. Hello, what's your name?
My name is Tim.
Timothy. All right, Timothy. You're also a doctor?
I'm a
Are
doctor
you a
as well.
physician?
I'm a physician. I've been practicing in a hospital for a while, and I'm trying to solve, we are solving a problem that I had many days walking up and down the wards. And that is chaos in a place that most of you will never want to go to, but unfortunately most of you will at some point in your life, the hospital. Hospitals are very chaotic, and processes are not perfect. And we want to make that a better place by removing the standard of care, this, and by introducing the digital to-do list to hospitals. Yes, they don't exist at this time in hospitals, and they don't exist on this screen right now. But we do offer a solution that makes it really, really easy for clinical teams, namely physicians and nurses, to work together collaboratively as a team and provide excellent care to their patients. And that's really important because of two things. One, hospital processes are really, really inefficient, and that makes them costly. And most of us know that hospitals these days are losing a lot of money, and that's not sustainable. And the second thing, which is even more important, is all of our health processes in hospitals lead to people dying, and we don't want to die. So let's make healthcare better. Let's get together as a team. By the way, kumi, our company's name, means team in Japanese, because we fully believe in the fact that healthcare should be teamwork at its best. And we make teamwork easy with our solution, and thereby we want to rethink healthcare provision and make this place, hospitals, a better place and a safer place for all of us.
I think we'd all be grateful. Yeah, the clock didn't work. Interesting that nobody came up with that idea before, isn't it? Because that's basically, I mean, that's a to-do list. I mean, they might also use a Wunderlist or whatever. I mean, there are about heaps of to-do lists on the internet.
Exactly, exactly. And interestingly, some people start using things like Wunderlist in the hospital setting, which doesn't really work for most cases, and thereby is not good enough to replace this thing. If we're honest, we're competing with pen and paper. And pen and paper can be a very strong competitor because it's been around for many years and people are used to working with what they know. And people don't like to change very quickly. So we need to build something that is really, really well adapted to workflows in hospitals, which solves problems of the frontline workers that treat patients, namely physicians and nurses, and which they love because it makes their daily job easier. And if we can do that, they will be willing to switch from this to something like this. And then we get better healthcare, which is more affordable and helps us all together.
What stage are you in? Have you investors, angels?
Yeah, we're actually right now, this week and next week, in the process of closing a seed stage funding round.
Okay.
Where we're bringing some business angels on board. If anyone is still interested in supporting us there, we're, as I said, very much closing right now, but talks are always good. And then we started developing with a partner hospital in northern Germany, where we will have our first implementation, and then we will try to scale it from there.
Excellent. Wish you all good luck in our own interest. Please have a seat. And we move to a city that will for sure not host the Olympic Games. At least not for, I don't know, a couple of decades. We're going to go to relayr from Berlin, Germany. And whatever a relayr is will be told by Jackson. Jackson, what's relayr?
Thank you, Thomas. Hello, everyone. So the Internet of Things, the Internet of Things. Everyone's talking about it, and we say, stop talking about the Internet of Things and build something. Build something very fast. We create an end-to-end tool set, an easy tool set for building Internet of Things solutions for your business or your customers. How do we do that? What are the tools? Well, there are 3 tools. We start with the hardware. We've got a chocolate bar. If you can see this little bit of chocolate here, it looks like chocolate. It's as fun and easy as chocolate, but actually it's smart chocolate because on the other side, we've got little sensors with Bluetooth enablement, so they can connect to the internet and give you sensor information. But that's only the beginning of it, because if you're developing a solution, well, you need the sensor data, temperature, humidity, movement, light, color, proximity, sound, all of these things. But actually, to build a solution, you need software. You need to have the software development kit. So we have open source software development kits on the other side for the software developers so that they can access that sensor data and build solutions rapidly. And in the middle, the third component is the cloud solution. So we have a platform as a service that aggregates all of the data provided by different sensors and provides that easily managed to the software developers so they can start building their apps and their solutions. What has happened? we launched our product, the Wonder Bar, in October. We started shipping it. We now have 1,600 developers on our platform. We have now Bosch Siemens as a customer because of rapid innovation. We have, up here, we'll be showing a demonstration with Coca-Cola, also the Bosch Siemens demonstration. These are applications that were built by interns, junior developers using the end-to-end tool set, using the sensors, putting them on top of devices and building applications for remote diagnostics, for example, for 22,000 machines, Coca-Cola machines across Germany. Easy solutions. Make Internet of Things easy. There's no reason why we have to spend months trying to build a solution. Oh, is the time up?
The time is up.
Okay, sorry.
The last one phrase.
Good.
To round it up. No, but could you give us some examples
Yeah.
we all understand of applications that have been built with the Wunderbar, which is a wonderful name, by the way.
Thank you. Yeah, so the Wonder Bar.
Wunderbar, it's an U in German. Okay.
It's yeah. We said because we are based in Berlin.
Okay.
I sound American. I am American, but I've been in Berlin for 23 years.
Okay.
And we were actually in Amsterdam when we came up with the idea. It was called KitKat originally, but then we thought we don't want to have a lawsuit from Nestle and Google at the same time. So we just come up with a different name, and we came up with Wunderbar.
Much more wonderful, I would say.
Wonderful, yeah, I think so too. But the applications, so on our stand, we're showing a variety of applications for small businesses, all the way up to gigantic global businesses who are using it. We've got some demonstrations, like I said up here. Global companies like Coca-Cola, we have an integration we just announced yesterday with Salesforce. So if there's any Salesforce customers out there, now you can build Internet of Things solutions that integrate with your Salesforce.
Any MedTech applications already? Because that's the MedTech panel. So I mean,
Well,
it sounds suitable for that too, or?
Thomas, I'm glad you asked.
That was coincidence.
I'm
I
glad
didn't
you
know
asked. So we enable any vertical. So medical is one interesting vertical. There's a lot of activity around it. And I think one of the people here, the showcases here, Amin, I'm looking at Amin. We were able to reduce Amin's development time. So he was prototyping, he was telling you, over 2 years. Now imagine you're prototyping over 2 years with certain hardware, and suddenly there's this little thing over there, and that solves all your problems. Well, that's sort of what happened. Our tool set reduced his development time from about a year to 1 day. A year to 1 day. That was the first prototype. Of course, he's developing it further. He can tell you about how that happened. But this is what it's all about. Internet of Things is not complex. What is it? It's sensors connected to the internet. That's all it is. And if you have the tools to develop and connect them, then bingo, you've got your Internet of Things solutions for healthcare.
And you wondered why it's so difficult. It isn't. So what has been difficult in the last years since you've started up? What would have been the biggest challenges you met?
Being fast enough.
Fast enough?
Well, we are founded 5 months ago.
Yeah.
We have a running app. We have a running hardware and 2 platforms, but I would love to be faster.
5 months sounds fairly fast. You've been in the game for 4 years, you said. What have been your biggest challenges so far?
I think there are many, many challenges, the technological ones, the business ones, the marketing. But for me, it was very interesting to see that when you create a product from a need you have, and you say, I want this to be used by 100 or 200 or 500,000 people, it's a very interesting process to go from your own need to covering a big spectrum of the market. And I realized, well, the team realized that it doesn't matter if you have the best technology or the best business team in the world. It's really how you formulate it and how you put your value proposition clear enough so that you achieve the target of wide reach. And that was very, very interesting to see, and it still is a challenge today.
Timothy, what was your biggest challenge? German bureaucracy?
Well, realizing and looking forward, challenges is in a B2B world where we're producing for hospitals, software as a service for hospitals. It's just understanding the fact that healthcare industry is not the fastest moving in terms of digitalization, and that traditionally software for hospitals has been produced for the CIO, and it's been top-down implemented, and the users just get shit which they use and which they don't like, and it ends up with shit medicine that they provide. So turning that whole game around and producing something that really solves the user's problem and makes it easy to provide great care is something that the users love and what they tell us. But it's not really easy to turn around an industry and find the willingness to pay and get over all these hurdles with incumbents being in a strong position to milk their cows and run their business models and be in the position that they're in. We will need support from politics. We will need money to enable this market, which is not a free market. It's very regulated. And that will bring a lot of interest in from startups that can really disrupt this industry and make this healthcare a better place. But it's not an easy game.
But isn't that the big opportunity? I mean, if you said,
huge.
could you please replace shit by the word of garbage? So if to replace garbage should be easier than to replace great products, as they are in a lot of fast-moving consumer industries.
It is. But it's just you have to have. You need a lot of money and you need time to understand that this industry is not moving fast. It's just the way it is, and especially slowly moving in Germany. And as a society, as a country, we're at risk at really lagging behind others because the world out there doesn't really care that much about all the problems that we're putting up there that keep us away from moving along faster and solving the problems that we have. And we have huge and massive problems in healthcare that we would be able to use to solve nowadays that the technology is there.
Jackson, I'll get back to you in a minute, but just want to stick with the MedTech guys, because obviously certification will play an important role in that sense. And how you overcome this? I mean, obviously you compete with players who've been licensing and going through regulated processes for decades and decades, and now you come, smart guys, smart ideas, and you're faced with a bureaucracy of industry of certificates that are very hard to get, including the lawsuit issue, I assume. If the stuff doesn't work, you don't probably want to deal with lawsuits if you think fail. How you deal with that topic?
Well, our approach is, at first, we don't need a typical medical certification, because we just exchange CD and paper as the interchange format between patient and doctors. So a paper is not a medical thing, it's just out there, okay? So right now, we don't need to have any certification. Of course, we need to make sure it's secure.
You have privacy issues, I assume?
Yes and no.
Okay.
Because if I hand you the data, you're my patient, and I give you your X-ray, for example, you can make a photo and post it on Twitter if you want.
Okay.
It's up to you. It's your data. Okay. As soon as we hand it over to you, of course, we have to make sure it's a secure container. And because we don't use a cloud solution, but we'll attach cloud solutions along the way, we don't have the privacy issues to solve. They have to solve. Okay. Of course, we need to make sure that the connection between our Life app and the smartphone app is very secure. That's why we have developed a secure near field, so you only exchange data in the range of 20 centimeters.
I mean, are you afraid of lawsuits if that thing, for whatever reasons, doesn't work as well as you hope for, and if you sold it on Indiegogo and got a real problem, maybe?
Well, we're really very happy that we're operating in the consumer products market. This is not a medical device.
Okay.
So it does not fall under this jungle of certifications and so on. Yet, everything comes with a liability, especially in the US, where when everyone has a headache, he goes and sues someone else. And we have that covered. So our team, we have part of the team that's having that covered. But most importantly, the most important kind of quality standard and certification for us is that we're doing this for ourselves. I'm doing this for me and my little brother, and for Johnny and Linus, the sons of my partners. And quality and reliability are not a question at all. It's a zero compromise there. So most probably the second generation will fall under the medical certifications. It will be a major development, but by then we'll hopefully have the resources to do that.
Mm-hmm. Have you had any interesting talks here? I mean, obviously you're here to make connections. Any interesting leads of potential customers you've talked to at the booth?
Lots.
Lots?
Lots.
What's the most promising one?
Well, there was a large multinational conglomerate who said basically the same thing that we've heard almost at every trade fair we go to, which is we have R&D. We need to have an Internet of Things solution. We understand that there is potential out there, whether we're a medical provider or medical solutions provider or a logistics company or a machine manufacturer. The problem is to get something done for this super fast-moving new evolutionary stage, Internet of Things. I mean, it's moving extremely fast, right? If you think of the time frame, 1993, the first browser came up. It wasn't until 2008 when mobile applications began to disrupt browsers. So we all look at our phones now. That was 2008. 2013, Internet of Things started to kind of buzz around, and now it's already happening. Everything's things. Everything's about the things and the sensors. So how do you keep pace as a big company with this evolutionary speed? And they say, does this thing, does your tool set, will that help us? And we say, any of your developers can build an Internet of Things solution in a few hours. It should be that easy so that you can start thinking and operating at startup speed. And I think that's the message. And this company that we talked to said, hey, that's exactly what we need. We need a way to break through the R&D pain and start iterating at startup speed on solutions for the Internet of Things. And that's what we've heard time and time again. That's what Bosch Siemens was interested. That's why we're working with Salesforce, with Eurocell, with all of these companies that have come to us with the same problem.
Excellent.
Innovation speed.
What we need is not another Snapchat, is not another Instagram, is not another social community. We need guys like those who make medical care better than it is, that challenges routines that we all suffer from. And so I hope all of you, and we need people that enables that. So I wish you all good luck for the contests. And later on, you'll know if you're part of the 10 finalists. And well, if that was interesting for any one of you, please visit these 4 startups at their booths. And don't forget the social voting, because there's an additional prize for all the contestants on which you decide, and you'll find the social voting on our website, code-n.org. Thank you for being here, and good luck with the contests.
Thank you.
Thank you.